Good afternoon, everyone. Welcome back. We hope you had an enjoyable lunch, and I would like to introduce you to the first speaker of this session. It is Dr. Pelly Koufaki, who is a reader in clinical exercise, physiology and rehabilitation sciences at Queen Margaret University in Edinburgh, and her session is entitled Move More, Sit Less. Please welcome Pelly.
Thank you very much. I am Pelly, and thank you very much, first of all, to the organizing committee for inviting me here today. It's a great opportunity for me to talk to you about physical activity and exercise, which is something that I have been doing for the last 20 plus years in the context of chronic kidney disease. So today I'm going to focus on this concept here, move more and sit less. So hopefully that's something that you have all come across it at some point in your lives, which is great, because this is not a new concept, it's not a new idea, it's a really well communicated and circulated public health guideline, especially in the last 5 years, that aims to encourage people in all ages, people living in all different health conditions to take up more exercise and break up sedentary time they spend sitting. Okay, so this is the next one. The UK is one of the countries that has subscribed to this initiative, put together and publicized by the World Health Organization. It's an action plan. It's called More Active People for a Healthier World. They set out a number of targets, objectives with a mission and vision to provide opportunities and enabling environments to allow everyone to participate in more physical activity. A number of objectives and targets have been set out, 2 of which relate to physical activity. So one being to reduce insufficient levels of physical activity by 10% by 2025 and by 15% by 2030. And the other one, which is a newer addition in comparison to the previous physical activity guideline documents that we have, was to reduce sedentary behavior through promotion of incidental physical activity. Unfortunately, we are a bit off track meeting those targets because the surveillance report that was published a couple of months ago in 2024 indicates that the global population have actually increased physical inactivity levels by 5% instead of reducing it by 10% by 2025, as was the original plan. So we, humans, seem like we're becoming less rather than more physically active. And at the end of the day, we all have to endorse this concept. We all have to fully cooperate if we are, to realize the health-related benefits that are associated with physical activity. And what are those benefits? We now have strong and good quality evidence that basically have informed the most updated guideline documents produced by the World Health Organization, but also by the UK government as well. So we have our own kind of national guidelines, which are well aligned with global ones. So these guideline documents actually come from evidence from people belonging to the general healthy population, but also in adults living with a number of different chronic conditions. So more physical activity is actually strongly associated with reduced all-cause and cardiovascular disease mortality, incident hypertension, and better management of blood pressure control, incident site-specific cancers such as breast, bladder, colon, esophageal, endometrial cancer, and more, incident type 2 diabetes, symptoms of anxiety and depression, falls and related injuries in the older population, osteoporosis, and also we have significant and meaningful improvements in outcomes that relate to cognitive health, sleep quality, physical function, cardiorespiratory, and muscular fitness. Now, this graph that you see on the left-hand side illustrates the dose-response relationship between physical activity and health-related outcomes. So basically, the more time you spend, let's see if this works, the more time you spend being physically active on a weekly basis, you know, the steeper the rate of improvement and the magnitude of impact, beneficial outcomes that you see, that you experience in all these different health-related outcomes. Now, the physical activity and the sedentary type of evidence in the context of chronic kidney disease is not as well established or as extensive as the evidence that we have from other populations, people living with cardiovascular disease, for example, or people living in diabetes. But a couple of years ago, the then Renal Association commissioned a clinical guideline document that was published a couple of years ago, and they summarized the current state of knowledge in the context of CKD. So it seems that we have sufficient, at this moment, evidence that allow us to make recommendations that people with chronic kidney disease, if they engage in more frequent and more regular physical activity, there are some important, quantifiable, and substantial benefits that relate to blood pressure, physical function, cardiorespiratory and muscular fitness, and some aspects of quality of life. So really the message I'm trying to get across to you today is that if people with chronic kidney disease engage in more physical activity, they're highly likely to actually safely experience the same rate and range and magnitude of benefits that we actually see from populations where we have better quality and more extensive evidence. So the message here is be more active, and we have some evidence to support that recommendation. Right, so let's see if technology works. I wanted now to just engage a little bit with you and actually try and capture what the physical activity levels are from people in this room. So I have provided you here with a couple of options. If you do have smart enough phones that are able to read QR codes, if you read that QR code, it will take you to an Excel online calculator, which is the general practice physical activity questionnaire. In order to be able to read the spreadsheet and respond to it, you also need to have the Excel application installed on your device. So if you don't have the Excel application or if you don't have smart enough phones, there is another option. So these are the different groupings, the different categories to classify physical activity levels based on that general practice physical activity questionnaire. So try and be as honest as you would like to be or as you can be and kind of self-evaluate what your current physical activity level is depending on those descriptors. So let me know if you would like me to show you the QR code before or if you are happy to just do that. Are you able to access the Excel spreadsheet? Yeah? No? Okay, so if you can't, because maybe you you don't have the Excel application installed, just try and do this and just self-evaluate where you currently are in terms of physical activity participation. So I'll give you a minute or so to do that. Because, sorry? Yeah. Or these descriptors and try to self-evaluate. And once you've done that, then there is another task for you. You can join a Poll Everywhere session where you submit your responses. So again, if your phone, your device can read a QR code, just scan that. Alternatively, you can actually join the session where you can submit your responses by either opening your internet browser and type pollf.com/Pelly Koufaki, or you can send a text message to that number and putting in the text Pelly Koufaki, and that will take you to the page where you submit your physical activity level. And hopefully once you do that, we should be able to see what the audience thinks about physical activity levels. Excellent. Any other responses? I see 75% of the people who responded are self-identified as moderately active, which is good. Moderately inactive, active 20%. %38% active people in the audience, which is wonderful. Okay. So what does this mean? So we saw 75% or 45% moderately active and 18% moderately inactive, and we have no inactive people in the audience, which is great news. And 36% classified as active. So what does this mean? This is the kind of current recommendations on how active you should be aiming to be. And this is also another way that you can self-evaluate what you currently do or how far away you are from what we call the optimum physical activity levels for optimizing those health-related outcomes. So we can quantify physical activity in many different ways. One of the ways is to quantify the amount of energy expenditure spent on a weekly basis doing physical activity. So as long as you spend about 1,000 kilocalories a week being active, that's good. That means that you are meeting the minimum physical activity recommendations and guidelines. Or if you're accumulating between 150 and 300 minutes of moderate intensity physical activity on a weekly basis, that's good. You're in that optimum range for enhancing health-related benefits. In terms of frequency, the guidelines state ideally every day, but if that's not possible, on most days of the week. And you also need to remember that 2 of those days need to be dedicated to improving muscular fitness and strength. So engage with exercises that enhance your strength and muscular fitness. The type of physical activity doesn't really matter, anything counts, and it doesn't really matter how you accumulate that amount on a weekly basis. The old guidelines, they used to say you need to do at least 10 minutes continuously. That guideline actually has been omitted from the most up-to-date ones. It doesn't really matter as long as overall you accumulate at least 150 minutes a week on exercise. Most people these days have fitness trackers, wearable sensors, devices that record steps. So in terms of step count, the guideline, again, especially for people living with long-term conditions, is that you should be aiming to accumulate at least 7,500 steps on a daily basis. A new addition in this current updated guidelines is that you should try and limit as much as possible sitting time, a sedentary time. Now, this, of course, here doesn't look great, okay, but hopefully you had the opportunity to just take a few steps during lunchtime, and perhaps you can do it after. In this audience, we had 0% classified as inactive. I don't know how true that is, but maybe it is. So these are data from a study that was published by the Leicester Kidney Lifestyle team a couple of years ago. So these are data based on actual CKD patients from 5,000 people who took part on this online survey from 17 different renal units in England. So this is what CKD people report in terms of how physically active they are. So the dark sections on the bars actually indicate inactive and moderately inactive people, and the lighter part of the, no, that's not the laser pointer, okay. And the lighter sections actually indicate the proportion of CKD patients that meet the current physical activity guidelines, and that range from 0 to 34%. So in terms of, based on data from 5,000 people, 74% actually currently were classified as not meeting the current physical activity guidelines. They also tried to capture the type of physical activities that are more prevalent or more popular in the CKD population. So you see here that most CKD patients actually do walking or housework and childcare related activities and some gardening, and only less than 30% actually engage in regular and structured physical activity or cycling. So if we have 0% of people actually being inactive here, that is a great result. Now, one of the new additions to the physical activity guideline documents is to try and limit sitting time as sedentary time. And the reason this has been added is because we now have enough evidence, research evidence, to demonstrate relationships, harmful relationships between time spent sitting and outcomes such as all-cause mortality, cardiovascular disease, incidence of cardiovascular disease, cancer, and type 2 diabetes. So that's why the guideline group have actually added this new recommendation. The good news, of course, here is this last kind of recommendation that if you do spend a lot of time sitting, because sometimes we can avoid it because that's the nature of your work, you can counteract the harmful impact of that sedentary time by actually engaging in more physical activity. And there is a benefit of actually sitting less. What I wanted to show you here, because I thought that was very, very interesting, is that there isn't really a lower threshold at which we see favorable changes in health-related outcomes. Because if you notice here, this green line that indicates the benefits associated with more time in physical activity, it's a kind of an increasing trajectory, right? The interesting thing is that even when you move from being sedentary, from spending a lot of time sitting to doing some activity, that actually is associated with the fastest rate of improvement, because that's the steepest part here of the line. Of course, there is an optimal range, that's the minimum recommendation levels, that's the green area, that says you maximize the benefits if you engage in this amount of exercise, and also the reason we recommend this, because that's the level that is associated with a minimum risk and harm that sometimes we have from exercise and physical activity, okay? But you'll hear a lot these days the message of doing something is better than nothing, right? That's another public health message that we hear. And a lot of effort, especially in organizations like NHS these days, is to help and support people who are classified as inactive to make that behavior shift, to move them from being sedentary, from spending a lot of time sitting, to doing something, because that will actually confer a big favorable outcome. And given that the largest chunk of the population is inactive, that will actually have the biggest impact on public health outcomes as well. So break up the sitting time actually and do something, replace it with something more active, actually is also associated with some benefits. Right, another self-test. Let's calculate how long you spend sitting. Have you ever done this for yourselves? Have you ever estimated how long you actually spend on a typical day sitting? So, if you scan this QR code, it will take you to a web-based link and basically just answer the questions there. Or, again, if you don't have the ability to read QR codes, if you type in Google, Devon sitting calculator, that probably should bring up that online calculator as the first kind of result. So tell me if you've managed to do that. Can you access this online calculator? So just answer the questions as honestly again as you can be. I'll give you a couple of minutes. Shall we just stop it here? Are we happy with this? 67, 29? Yeah? Okay? Now, again, from the current evidence that we have, it has been identified that spending more than 8 hours in sitting on a daily basis is actually associated with significant negative health-related outcomes. And actually, the highest risk is associated with spending more than 9-10 hours a day sitting, okay? So, but like I said, the good news is that we also have evidence right now to indicate that if you do spend that amount of time sitting, so even if you are at this top left-hand side corner, which is at your highest risk because of sitting, and actually you're also inactive, that is, you are at the highest risk of experiencing those negative health outcomes. But you can reverse that relationship by engaging in more physical activity. So even if you're sitting a lot of time on a daily basis because of your work, if you engage in more activity, you can move yourself to this green area, which again means that you have eliminated, you have minimized the risk, the harmful risk associated with prolonged sitting. So, based on the current information that we have, if you sit more than 8 hours a day, you can eliminate the risks by engaging, by doing basically anything between 60 and 75 minutes of moderate to vigorous intensity exercise per day. So, that's good news, because it means that physical activity is a modifier. It can modify that risk associated with sitting time. The World Health Organization also has an implementation group, so they try to come up with ways to support people, organizations, governments, how to implement those action plans that they put together. And they have identified that actually walking is one of the most cost-effective way of implementing physical activity, the physical activity guidelines. And we can all understand why, because walking is something that we all do. It's not associated with any additional costs. It's not kind of associated with a higher risk, and it's easy to integrate in daily lives. And given the fact that actually the majority of the CKD population have reported walking as the most popular or prevalent physical activity, it seems right to indicate that that's perhaps where you should all start from. Just increase your walking, the number of steps that you take, the pace at which you walk on a daily basis. Integrate those extra steps, in between sitting bouts. For those who want to do more, I have listed here a number of different resources that have been developed by a number of colleagues, organizations with CKD in focus. So they're all in relation in the context of CKD. I'm told that the organizing committee will share those slides, so these are all clickable links. So once you get them, you should be able to click on them and access the information and explore the different resources on your own time. Unless you want, do I have time? No. So that's it. Thank you very much. And I'm happy to take questions now or later.